How do I explain a pap smear or a pelvic exam to patients who have never had one before? Well, that's a great question. The first thing I would say is hopefully they have been exposed to this at least somewhat as they were younger and grew up, which is why I always think it's a great idea when women bring the younger women in their lives to their exams, as long as they're comfortable with it. That lets them learn a little bit about what to expect, as well as learning about medical consent, because consent exists in all aspects of life, including healthcare, especially in healthcare. Now, let's say that's not the case, and a patient comes in and they know nothing. They're in their 20s and they want or need an exam. First of all, thankfully I have lots of models, and I make sure that first and foremost that they know all of their anatomical structures, because if they don't, there's no way for me to actually tell them what we're going to be doing and get informed consent. So we go through and we make sure that they know all of the correct anatomical structures, because that's how I'm going to speak while we're doing the exam and when I'm trying to get consent. So we go over everything from the clitoris, which there's no need to be near during this exam. We go through the labia majora, the labia minora, right? The introitus, the entrance to the vagina, the rectum, because yes, sometimes during these exams, you do need to examine this. There may be the need for a rectovaginal exam, or maybe they have hemorrhoids. Now, again, all of these things, anytime you're going to be doing an exam and touching any part of these areas, you need to have consent, which means you need to explain what you're doing and why. But for the sake of a traditional pelvic exam and pap smear, remember that they are two very different things. A pelvic exam is the visual look of the vulva, all of the external parts, and using a speculum inserted in, this is the Nellikine speculum, by the way, I love it. As a built-in light, it is one of the smallest speculums that they make, and it has built-in side holders that, yes, looks a little bit like the guy from Predator, but it works very well, and patients report so much less pain and discomfort with this. So I really like it. But you insert the speculum into the vaginal opening, and then you open it. This allows us to have a good view into the cervix, the vaginal tissue, and make sure that everything looks appropriate with the anatomy. Now, when we do that, if we're doing so at the time and we're doing a pap smear, we would then use a brush to collect a sample of the cervical tissue to look for precancerous or cancerous cells, and sometimes doing a test to look for HPV cells. But a lot of this depends on the patient's age, because HPV is around in a lot of places and a lot of people have it, and younger healthy women often clear HPV without any issue. So who gets an HPV test is often dependent on the person, their risk factors, and their history. But when we collect that tissue, we then place it into a container and we send it away to the lab for culture. When we get those results back, not necessarily culture, but for examination, when we get those results back, we can notify the patient, and then that determines their risk factors and whether or not we want to do a repeat exam in a year, 3 years, or 5 years. And depending on their age and risk factors, maybe we're all done with these types of exams. But again, I need to stress the point that these exams should not hurt. If your medical provider is going slow, using the appropriate sized speculums, which should be the smallest one possible for your anatomy, using appropriate lubrication, not being overly aggressive collecting the sample, then this exam should not hurt. Now, is it gonna be comfortable? No, probably not. Is it gonna be awkward? Abso-freaking-lutely. But we can do a lot to make you more comfortable, like keeping you as closed as possible. I don't need you naked from head to toe to do this part of the exam. I don't need you undressed for the whole rest of the exam that we would be doing. Over here just knocking this thing over. There is a lot that can be done to make you feel safe and comfortable, and I always encourage people to bring a support person with them if that's what they choose. Additionally, ask questions. Talk through the exam if you want to. Maybe you have a history of trauma, and it's appropriate to not only bring a support person, but maybe offer you something for the anxiety leading up to that. But there's a lot that can be done.
Oh yeah, love ya.